you have this remote work component, which there was always some companies, of course, that a large portion of their workforce was in fact remote. But what you see now is this huge desire for more workers to work where they want to work at the times at which they want to work. This flexibility, this on-demand concept that we've never seen before.
This is Rob Hoyle, and thank you for tuning in to Northwell Health's 20-Minute Health Talk, where some of the brightest minds in healthcare help us break down the latest news and developments. I'm alongside my co-host, Chris Guzewski, and our special guest, Joe Moscola, Chief People Officer for Northwell Health, the head of HR. Joe, thanks for being here with us today. I want to change things up in our program. I want to go to our segment called Knee-Jerk Reactions. It's like a lightning round where we'll ask for your immediate response to the following words and phrases. First up, the future of work.
So first, knee-jerk. Rob, Chris, thanks so much for having me here. Pleasure to be with both of you, talk about some of these topics. Future of work. The word that would come to mind would be transformative.
And what do you mean by that?
Yeah, so pre-COVID, when we do our analysis on the future of work, you have a lot of different things happening. You've got generational exchanges. What do I mean by that? You've got the baby boomers beginning to retire. You've got this huge influx of millennials. And so this notion that you're going to have this exchange of knowledge and the way in which people work, that was all pre-COVID. Now enter COVID. You have this remote work component, which there was always some companies, of course, that a large portion of their workforce was in fact remote. But what you see now is this huge desire for more workers to work where they want to work at the times at which they want to work. This flexibility, this on-demand concept that we've never seen before. There was a study that was just recently released where they interviewed employees from employers of all different industries across the country, and 9 out of 10 workers said that they wish to choose where they work from. That's not to say that they don't want to go to the office. They do. It's just a matter of when and how and the times at which they work. The challenge in all of this becomes, okay, so we're evolving the way we work, the tools at which we use, what the worker looks like. And now we've got to figure out how do we maintain culture in the concept of all of that. That really helps identify the brand that a particular business or company stands for.
So just like telehealth has changed care, remote work has changed the way people think about work and employment.
Absolutely. I think what we've seen, and true, Chris thinks it's a great point around telehealth. Telehealth's been around for a very long time, well over a decade. But it's the speed of innovation, the speed at which we're adapting and accepting these types of changes. That's really what this last 7 to 8 months has been made it so unique that we've had to evolve at such a rapid pace.
Next phrase up was returning to the office. Now, I guess not everybody's going to be able to work from home. So when the people do have to go into the office, what comes to your mind?
Safety first. You've always got to lead with an abundance of caution, especially now where we are in this pandemic. You see how quickly things can change. We're still so far away from this notion of herd immunity. And so if we slip up a little bit, we don't wear our masks, we don't wash our hands, we don't have social distancing, you can see how that can really impact a community, a college, a workplace. And so when you think about how you return to work, it's got to be with an abundance of caution. Otherwise, you're going to find that you're going to have a lot of sick workers pretty quickly.
Remote work, I know we just touched on that, but what's your immediate reaction when you think of remote work?
It's got to serve a purpose. What do I mean by that? So you can quickly take the concept of remote work and say, okay, I'm just working from home. But then you will quickly have a team member who comes to you and says, okay, I'm working from home. Things are going pretty well. You're monitoring my productivity. My productivity is good. Why do I have to live in New York? Can I live in Chicago? Can I live in Florida? And so now you get into a little bit more of a complex conversation and talent needs of the organization, the sort of supply and demand side of hiring team members into an organization. Where do those skills actually exist? Where are the colleges and universities that produce those skills? And now you sort of broaden that concept a little bit more. The other piece too, when employers and business owners look at this concept of remote work, the ability to monitor productivity in a way without feeling like Big Brother's constantly watching is such an important topic in this. Again, you want to be able to maintain culture. You want to keep people engaged, continue to generate a superior experience while still delivering on the business outcomes that business is intending to do through their goals, mission, vision, et cetera. Productivity is a big part of that. But you got to be able to implement that in a way where the worker feels comfortable.
What about wellness?
Huge. Plenty of studies coming out rapid fire over the last many months about this notion of burnout. Now, here in healthcare, of course, we had many articles about burnout pre-COVID, whether that's a result of the complexity of the medicine, the technology in people's hands, the electronic health record, et cetera. So many different factors that are leading to those causes of burnout. Now you enter in COVID, what the healthcare worker has been through over the last many months. This notion of resiliency takes on a completely new meaning. Now you add the work basically round the clock. It's hard to turn it off. Even if you're a clinician on the floor, maybe you're getting sent your patient load for the next day, and so you're reviewing that at late at night when you should be sleeping. Or if you're in more of a corporate space, I say in air quotes, you're on conference calls till late in the day, you're answering emails middle of the night, and that's become a little bit of a norm. So you've got to set some boundaries, and I think that's a really important part as we continue to evolve this future of work.
Yeah, I think one of the things that people always talked about before COVID was this work-life balance. And so working from home is a kind of a nice work-life balance a little bit because you can keep an eye on your kids and everything else. But right, you said the day all of a sudden extends past 9 to 5.
Yeah, just to stay on that for a moment, Rob, it's this fascinating thing too. Okay, so I'm working from home. My kids are home too. This adds to the challenge and what I'll otherwise call the burden of being home, especially if you think about even just the differences of ages, whether you have pre-elementary, elementary age, high schoolers, or elderly parents, grandparents, aunts, uncles, et cetera, whatever your personal situation looks like, that personal obligation blended with the work hour has created such complexity that when we talk about best places to work and what those superior organizations look like, they're the ones who are trying to tackle that issue at the same time. Now, that can be a remarkably expensive sort of proposition to take on very, 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 very quickly. But you've got to have these solutions, because then what's the end result? There's also been a number of articles written recently about the impact of the economy, the layoffs, but then also some of these concepts that we just talked about, in particular on gender, females in particular, being the person who continues to take on more of that responsibility within the home, the caring for all those individuals I just mentioned, without the support from the employer and the complexity and challenge that adds, the stress, the burnout. But then the notion that, look, I don't know that I can sustain this. I may as well just step away from the workforce for a little while I take care of the kids, mom and dad, et cetera. So it's a challenging time, and one that when we, again, talk about future of work, transformative, how do we continue to put services around the team member so they can be their absolute best, whether that's at home, whether that's for the family, or whether that's at the workplace.
Yeah, having flexibility certainly, worked out for me and my family because I do have young children. But it's almost as what you were saying, like the workday never ends. Those emails come in, you got to respond, you got to do what you got to do.
Yeah, it's the blessing and the curse, right? And so, the approach we've been taking here at Northwell is certainly there are never any all or nones, N-O-N-E. It's this concept that there's got to be a flexible model, and it's got to be about what we are calling working well. And well, in its truest sense, you've got to continue to focus on the well-being, focus on the engagement, focus on the experience. And now the difference for us as an employer, It's the 24 hours around that team member. It's not just the moments that they're at work.